Hello, welcome. You are all agent partners. We're so happy to have you here with us today to go over the CMS final ruling webinar. First, some perspective. Today is Thursday, April 11th. We typically don't go over the date because you can watch these on demand. But I think in this case, it's really important because this new ruling just dropped last Thursday evening. So I believe around 4 or 5 o'clock Standard Eastern Time. So we've had about a week to digest it and share our findings with you today. All right, so just to get started, I want to walk you around your screen if you're not familiar with our webinar platform. So you should see Karen and I live, the slides there in the middle, and to the bottom right, you'll see a blue chat box. Go ahead and click on that. It's going to open up a public chat. You can change it to presenters or private. There's a Q&A section there for you as well. So if you have any questions, please put it in there so one of us can answer it for you. Polls, we don't have any polls today, and then handouts is just some links to our website. All right, here we go. And, you know, in all fashion of talking about rules, we're just going to start out with a little warning and disclaimer. Our goal here today is to share with you our interpretation of the new CMS ruling for 2025. So Karen and I would like to preface that with, we are not attorneys. None of this information has been confirmed. We are not here to represent CMS. It's simply our opinions from reading the 1,327-page document over and over and over till our eyes were bleeding. And you are more than welcome to read it yourself and have your interpretations about how it is written. You will, and I have seen and heard some different opinions already on the internet. I will tell you that I've reached out to some of our carrier partners and some of our relationships already, and they will not release statements because their lawyers or their lawyer team are still digesting the information. So we are telling you what we know at this time. Please do not believe other agents making videos out there that are on YouTube or LinkedIn or Facebook. We are your FMO. We'd hope that all your information would come from us, and we'll continue to keep you educated as we learn more in the upcoming weeks and months. We'd like to remind you about when new things do come out, big changes like the call recordings, okay? It comes out, everything's on fire. The carriers go to the full extreme of the law, then to come find out after the AEP, you know, CMS comes out with a statement and it's way dialed back. So, you know, things might seem extreme now, but I don't think that was the intent for CMS. So continue to keep yourself educated as the upcoming weeks and months come. And we'll know a ton more during our conference at the Hershey Lodge on August 22nd for sure. So make sure you come to keep yourself in the know. Our slides are going to focus on things we thought that you'd want to know and have interest in it, thinking about your clients in the upcoming year. It's not all the changes that were proposed. It's a very long document. A lot of the changes apply to the MA carrier, so not necessarily have anything to do with you at this time. We will be reading a lot of slides word for word, which is something we typically don't do, but we just thought it was important for you to see how CMS words it and addresses it. And you will notice that there are a lot of comments that were made, and by you, they're shown, and then also how CMS responds to those comments and how it has changed CMS's mind. So we just wanted to thank you for a job well done for those of you and your fellow agents out there that did take the time to comment on the ruling before they put out the proposal, because it clearly made a difference and did change some minds. So thank you so much. Job well done. This could have been much worse. It was proposed to be worse. So this is something that we can continue to navigate through these changes. It's not going to destroy the industry. We're here to stay, and that is all great news for everybody. We're just going to go in the order that it is in the CMS document. So if you're like, why are they going in this order? That's why. So why are we here today? It's because MA is growing so fast. CMS estimated that 2 million new Medicare Advantage enrollees are coming on every single year, and that 50% of those enrollees utilize a TPMO, which is a third-party marketing organization, could be an FMO, or an agent and broker to assist them. Where are they getting that number? I have no idea. We have no idea where CMS gets their facts, but that was specifically mentioned in their document. Okay, so the first thing that they hammer out in the release is MTM, so Medication Therapy Management Program. So that is designed for the Part D drugs to optimize therapeutic outcomes through improved medication use and to reduce the risk of adverse events, including adverse drug interactions. So that's how it is currently. That's the purpose of the ruling. How they're going to change it is they want to make sure that all plans are now required to include all Part D maintenance medications when identifying beneficiaries. So they did take a look at decreasing the number of drugs to 5. It is now currently at 8. Through comments, you have all said to keep it at 8, and they are going to, in fact, keep it at 8. So there'll be no change to that this year. For the chronic diseases that entails, there was 9 this year. In 2025, there will be 10. What has been added is the HIV and AIDS. Behavioral health care. This is becoming more and more popular with America in general. So CMS is adding a new facility specialty provider category called outpatient behavioral health. That will include family therapists, mental health counselors, opioid treatment, community health centers, addiction medicine, and everything, nurse practitioners, physicians, clinical nurses, everything that has to do with addiction and behavioral health counseling. It'll be covered by Medicare, which is fantastic. So MA plans must independently verify that the new provider they add has seen 20 patients within a year, okay, to add them into their network. And they must include 1 or more telehealth providers. Data sharing. I think a lot of you would really appreciate this as some peace of mind, because you can get down the conspiracy rabbit hole sometimes about how your client's data is being protected or shared, or if clients go out on the internet and try to run a quote and their information is then shared across how many bands of different people and agents to get a quote. So they are putting regulations on this. So they're saying TPMOs have been selling and reselling beneficiary contact information to bypass existing CMS rules that prohibit cold calling, so they can aggressively market MA and Part D plans. So beneficiaries aren't aware that by placing a call or clicking on a web link, they are wittingly agreeing and providing consent for TPMOs to collect and sell their information for future marketing activities. So what does that mean? That just means they are definitely targeting call centers, in my point of view, for this. And for online advertisements, like, I don't want to use an organization's name, but that they set up those online ways to catch leads and sell them to a big group cluster of agents to all call aggressively. So to prevent this in the future, CMS will prohibit TPMOs from collecting personal data unless the beneficiary provides prior written consent. So that means that we have to get that consent, and through a very transparent and disclose from the individual to share the information and to be contacted for marketing and enrollment purposes. So they're supposed to understand that that's what's going to happen when they're providing their consent. The agency said the provision is meant to address complaints that individuals have been receiving unwanted phone calls and emails from brokers and agents trying to enroll them in an MA and Part D plan. And we all know that that's been happening. We've been receiving a lot of complaints from our agent partners that they're getting a call from a call center who's enrolled their client over the phone. The client didn't even know they enrolled into something. So hopefully all this will help those situations either, lessen tremendously or be non-existent moving forward. Okay, I know you've all been waiting for this. This is agent compensation. So I am going to read this slide because I think it's important for you to see how CMS words this. In this rule, we are finalizing requirements that will generally prohibit contract terms between MA organizations, so the carrier themselves, and agents and brokers, which is you, and other TPMOs, which would be organizations like us, that may interfere with the agent's or broker's ability to objectively assess and recommend the plan that best fits the beneficiary's healthcare needs. Okay, so their whole point of this new ruling with the commission is because they do not want one policy to look more attractive than the others in the eyes of the agent when selling it to a client. And not to say that's happening the majority of the time, but they feel that it is being induced by additional funds that are being given to you by either your FMO or the MA carriers. And that does happen. They give examples in the ruling, and every single one of them that I read, I have actually seen happen. So this isn't coming out of nowhere. Set a single increased compensation rate for all plans to be updated annually, which, if you've noticed, that does already happen. Your commission for Medicare Advantage and PDPs do increase every year with inflation. Typically, it's like a 2.5% rate increase. Revise the scope of items and services included within agent and broker compensation, which we'll explain on the next slide, and eliminate the regulatory framework which currently allows for separate payment to agent and brokers for administrative services. Okay, so what does that mean? Eliminate the framework. You may have heard the terms GA, FGA, or SGA, MGA, FMO, all of it. All those terms are going to be eliminated. That's the framework. Those are when agencies, not single independent agents, but agencies, receive additional override for things like administrative services. They are saying that is now eliminated for 2025, effective October 1st. This was a response from CMS to all the comments on compensation because it was all over the place. So they said, we want to thank the many commenters who provided us with a more complete picture of the many administrative and other services and expenses agents and brokers undertake when assisting beneficiaries with enrollments. So they're giving you credit on all the things that you do aside of just enrolling people and all the things that you pay for. So these comments have made us aware that in our initial proposal, we may not have adequately accounted for the array of services that agents and brokers may provide when we calculated our proposed payment increase. It was not our intention to make the MA compensation rate so low that agents and brokers would be driven out of the industry or would be unable to enter it in the first place. And that was a big scare for us. We want to make sure there's younger agents coming into the industry all the time to keep it alive. People aren't going to do that if it becomes, too hard to do or impossible because of compensation. So the original proposal from CMS was to increase compensation at $31. They increased that due to your comments, so a good job, well done, to increase it by $100. This is for Medicare Advantage and prescription drug plans, which is incredible because we know they are time consuming. So where is this coming from? MA carriers and TPMOs, which they are saying are like the FMOs, cannot pay any longer administrative fees or bonuses above fair market value. So they are putting a cap on commissions for the agents, meaning they're going to build in all these administrative tools that you need to run an agency and all the things that you have to pay for to be an agency on your own. They are to be paid by the compensation now, not from the MA carrier or from the TPMO or FMO. It has to all come from your compensation that you get as the agent. So no more AHIP reimbursement, no more HRA bonuses from the carrier, no more leads, no more co-op marketing, no more costs for booths at fairs or Walmart or CVS. No reimbursements of any kind are allowed to happen because that is payments to an agent above fair market value. And that going forward is going to be a no-no. So they do have an example specifically in the ruling. This is a screenshot of that example. It shows you 2024, which right now they're using the national average, not the state of Pennsylvania's commission, which is higher. Right now we're getting $689 for new. So the national average is $611. They use that. What does that mean? Does that mean that Pennsylvania is now going to also get paid the national average? Maybe. Okay. I have asked some Pennsylvania carriers. I've had one carrier come back and say yes, that we are going to pay the same commission straight across the board for every single state, and it's going to be the national average. Could they be wrong? Sure. More to come, okay? But as of right now, this is the CMS example. So in 2025, if they use the 2.5% inflation rate increase, plus the $100 that they're giving you for 2025, it would say the commissions for next year are going to be $726 on a new piece of business, new to Medicare, and the rate again for the renewal will be half, 50%. And then it shows you 2026 as an example as well. All right, Karen, I'll turn it over to you.
Okay, thanks, Christy. So moving on to Medicare Advantage supplemental benefits, those are the dental, vision, hearing, the food services that some carriers provide. CMS noted that Medicare Advantage rebates quintupled from $12 billion in 2014 to $67 billion estimated for 2024. It's a total of $337 billion over that time period. And there's been very low utilization of those benefits. Every year the carriers kind of come in and they're like, well, what do you think the beneficiaries would want to see in their plan? And, dental is a big one, but that's not being used. And, gym memberships, that's just not being used. So in order to make sure that those benefits are being used, CMS wants to make sure that Medicare Advantage carriers, they're going to require the Medicare Advantage carriers to notify members midway through the plan year any of the supplemental benefits that they have, and if they have not accessed them yet. It's going to be a personalized notification. It must include the scope of the benefit, the cost sharing, instructions on how to use the benefit, any network application information for each available benefit, and a customer service number to call for more information. To piggyback that, they will also require that MA plans have to demonstrate that special supplemental benefits for the chronically ill, SSBCI, that they offer meet the threshold of having a reasonable expectation that they will improve the health or overall function of chronically ill members. So a little different benefits for SSBCI. It's, structural home modifications, non-medical transport, food and produce, sometimes like pest control. Those are the different kind of benefits that are under the SSBCI. So the MA plans must establish and maintain information from relevant research studies or other data to demonstrate that an SSBCI meets those requirements. And they have to make sure that in any of their marketing that they are clearly marking, that not all of those benefits are going to be available to everybody. It's only, those certain benefits are only going to be available to the chronically ill. Revised quarterly SEP, existing Part D quarterly SEP for dually eligible beneficiaries and those with Part D low income subsidy is going to be revised. Under the new rule, beneficiaries can now change to a standalone PDP once per month throughout the year, offering greater flexibility, and a new integrated care SEP to allow dual eligible individuals to elect an integrated DSNP on a monthly basis. DSNP, limit enrollment in certain DSNPs to those individuals who are also enrolled in an affiliated Medicaid managed care organization or an MCO. They want to limit the number of DSNP plan benefit packages an MA organization can offer for full benefit dually eligible individuals in the same area. CMS's goal with this is to unify appeal processes across Medicare and Medicaid, reduce the number of plans able to enroll beneficiaries outside of an open enrollment, and crack down on year-round aggressive marketing. With Medicaid, since they can change throughout the year, those individuals are targeted heavily to change plans. Changes to the Part D benefit. A newly defined standard Part D benefit design consisting of 3 phases: the annual deductible, the initial coverage, and catastrophic coverage. They're going to have a lower annual out-of-pocket threshold of $2,000, the sunset of the coverage gap discount program, and the establishment of the manufacturer discount program, and changes to the liability of enrollees, sponsors, manufacturers, and CMS in the new standard Part D benefit design. So next I'm going to go through the different stages. The first stage that they'll go through is the Part D annual deductible. In that stage, the enrollee will pay 100% of the gross covered prescription drug care cost until the deductible of $590 for the calendar year 2025 is met. Second one is the initial coverage. In this phase, the enrollee will pay 25% coinsurance for covered Part D drugs. The sponsors typically pay 65% of the cost of the applicable drugs and 75% of the cost of all other covered Part D drugs. The manufacturer, through the discount program, typically covers 10% of the cost of applicable drugs. This phase ends when the enrollee has reached the annual out-of-pocket spending threshold of $2,000 for the calendar year 2025. Some of the costs towards the true out-of-pocket is the portion of the spending on covered drugs made by the beneficiary or on their behalf by certain third parties. The IRA updates which categories of payments count towards the true out-of-pocket spending. The true out-of-pocket is the spending that determines when a beneficiary enters the initial coverage phase, becomes an applicable beneficiary for the discount program, and then finally reaches the annual out-of-pocket threshold and subsequently enters the catastrophic phase. And then once they reach the catastrophic phase, the enrollee pays no cost sharing for the covered Part D drugs. Sponsors typically pay 60% of the cost of all covered Part D drugs. The manufacturer pays a discount, typically equal to 20% for applicable drugs. And CMS will pay CMS pays a reinsurance subsidy equal to 20% of the cost of applicable drugs, and equivalent to 40% of the cost of all other covered drugs, all other Part D drugs that are not applicable drugs. That's a lot. Okay, so what hasn't changed? In the past couple of years, from a compliance and of doing your daily job, we were hit pretty hard with the call recording, and then the 48-hour rule with the scope of appointment coming back. We kind of get a little bit of a breather this year. Nothing really new. Nothing new, really. Everything that was put in place the past 2 years is still the same. So you do still need to do the call recordings. You have to record all your sales and enrollment calls. You still do not need to record appointment setting calls or any follow-up calls that you may make to your clients after the AEP to make sure everything is okay. Now, if you're calling them after the AEP to check how they're doing, see if the plan is the right plan for them, and they say that I don't think it is, it turns into a sales call, you then would need to start recording that phone call. So again, only sales and enrollment calls need to be recorded. The scope of appointment, you have to have the scope signed 48 hours before the appointment, unless it is the last 4 days of an enrollment period, not of the month, of an enrollment period, or if it is a walk-in appointment. And I will tell you that we have a couple of carriers that have been doing scope audits, and they are looking at that intently to make sure that you have a reason of why it was not signed 48 hours before the appointment, if that was the case. And then the TPO disclaimer, we don't represent all plans. If we only represent this amount of plans in your area. If to see the rest of your plans, you have to contact Medicare. That's still required on all marketing material, including websites and emails, on the first 60 seconds of an enrollment call. Back to you, Christy.
All right, so just a quick summary of what we went over today, specifically that there is going to be no more agency overrides or incentives from MA carriers or TPMOs. So if you are the independent agent working at street level, you are not going to be affected by this. It is those agencies that are larger and producing at larger volumes that are going to have to pivot and navigate how they're going to operate in businesses. We expect to see a lot of, it's called LOA model, where, downline agents are selling under the agency and doing some sort of commission split. So if you need some guidance on how to do that, if you're not doing it now and you're running an agency, feel free to make an appointment with me and I can go over with you how other agencies do that. They're really looking to make it an equal playing field for agents, agencies, FMOs, and the MA carriers, most importantly. And it's all supposed to positively reflect the beneficiaries, okay? If you read through everything, it really targets the large TPMOs and the large MA carriers, because there's so much money being thrown around to push that specific product that the little guys like us or the little local insurance carriers aren't getting the fair treatment that they deserve through the quoting process. So hopefully this is equaling the playing field. That's CMS's intent here. TPMOs, FMOs cannot offer administrative and other array of services for reimbursement. We went over the list earlier. These costs for you to do business are now built into your agent compensation. You can't get anything above the agent compensation. So the big question and the big debacle right now on the internet, if that's going to include your Connecture, your Sunfire, your CSG quoting tools, right? Because we all live off those now. It makes life really easy. In my personal opinion, and I've read this several times, CMS's intent is to cut out reimbursement items, okay? It's the technology of CRMs. If you're getting an override to help pay for those sort of things, that's gone. If you were using call recording like Ring Central and you were getting, reimbursement from the FMO, that's now gone. In no way are we, as your upline, charging you or reimbursing you for Medicare Now, which is drive by Connecture. So I read that is not going to be an issue. Like I said, you'll hear things differently online. So at this time, that's how we see it. That's how we read it. Our lawyers are still processing all the information. All our carrier relationships, have not made comment yet at this time. They're still trying to figure it out. I did reach out to Connecture, our rep at Connecture. They just got back from a huge conference out in Vegas, and they said they've met with all the reps and they are not hearing that Connecture is going to be a problem for us to continue to give that as a free service. So until we hear differently, I'm going to stand on what I believe of how I read it. And I just wanted to end with a few direct quotes from CMS because I thought it was worthy of sharing. They said, "We believe that by making the full payments directly to the agents and brokers themselves will have the opportunity to decide which services are truly essential and how much those services are worth." So really, they're trying to put more money into your pocket than what we or the carrier would reimburse you for sales. That's their intention, and that's what they're saying here. And you decide what services you want to purchase with the money that you're given. And this is the last one I have here. It was not our intention to make the MA compensation rate so low that agents and brokers would be driven out of the industry or would be unable to enter it in the first place. However, we do believe it is important to ensure that while we support agents and brokers and the services they provide, the MA program and its funds are not being used to subsidize other programs and industries. So that's what they're trying to avoid again there. Did we have any last minute questions that have not been answered? I don't think so. Yes, Chris, our call recording option is on Connecture. I don't know if she got to that one. All right. Well, you can reach out to Karen and I anytime you would like with further questions. As we said, things will continue to become more clear as we get closer and closer to 2025. But these are the rules that are out and how we interpreted them for now. So thank you so much for joining us today. Have a good one. We appreciate your business.